First of all, I'd like to thank our group. The conversation was in about 20 different ways, but it was fun. The two things that I think, the two strategies that we're going to focus on is early education and prevention. And we've been talking about this for a long time in our community, but to refocus or double our focus on trying to get more prevention education for our younger youth. And then working with our parents, that's the other strategy. We had a lot of discussion in parents not feeling that they might not have the information they need to deal with their children and their children's use, and how to deal with use and prevention of potential use. So those are our two main strategies we're going to do.
So our group was Prevent Deaths from Overdose, and we also used a kind of did a support group for families and parents that are dealing with addicted family members or friends. And we broke up into two groups because we also we're going to be talking about the overdose and the naloxone, and it was too big of a group to talk as one group. So Malik is going to share that piece of it. So our support group, our group that talked about supporting families, basically had a lot of things to talk about. It was really a good group. We had we had providers in the group, we had family members in the group, and what we basically came up with at the end with the one key word was education, which is interesting because the prevention, of course, it's education too, but just needing to have more education in the community for families. They had a lot of questions about you know, the results of this, and how would you do that, and how do you talk to someone that's in prevention. And there's not lack of resources to help families do that. When you discover that you have a child that's in, or other family member that's in an addictive state, how do you talk about it? How do you move forward? What's the right thing to do? What's the next thing to do? And there's a frustration that those resources are not available or even known about in the community. They may be there, but people don't know how to access them. So education was one of our main things that we came up with.
Yeah.
So our group, we talked about making system-level improvements to increase availability and use of naloxone. And so the actions that we identified for some community-based naloxone would be to find a prescriber that could write an open prescription at a pharmacy, and then talk with that pharmacy around making sure that they have supply and making sure that they have the correct billing codes in order for people to be able to use their insurance to get that naloxone, to be able to have it for their family members. So we identified the gap as having an open prescription at the pharmacy. Some of the concerns that were raised were about polysubstance use and drug interaction, because oftentimes people are using more than one substance. And there was concern that if people are using stimulants and opiates, that with the introduction of naloxone to address an opiate overdose, that it might cause the stimulants to further damage the system of the person that's been using drugs. However, there's a body of research out there that shows that stimulant use along with opiate use is actually a risk factor for opiate overdose. So keeping a person breathing and making sure that the education piece, that was the other thing that we identified, is educating the public. It's really important that people recognize that they need to call for help. That is the first step in addressing an opiate overdose, is that you call for help and then administer naloxone. Am I supposed to say why I know this stuff? Is that oh, okay. Well, okay. And then the other step that an action is develop a program for naloxone distribution. The gaps, of course, are funding, and then also there is not a syringe exchange program in this county. So syringe exchange in Thurston County is an access point for treatment for people, and it is also a place where naloxone is distributed to family members and to people that use opiates. So under the comment section, I don't know if people saw in the news that there was a $5 million 5-year grant, $5 million 5-year grant that was awarded to the University of Washington from SAMHSA, the Substance Abuse and Mental Health Services Administration, to increase access to naloxone. Thurston County Syringe Exchange was one of the awardees of part of that money, and we are part of the your county is one of our catchment areas. And that funding is to fund the work of reaching into our whole catchment area. So syringe exchange, it needs to have sanctioned by the Board of Health in order for y'all to have a county program. That's.
Thank you very much.
Hi, I'm Joe Sanchez with Public Health. It's amazing that this county was able to bring everybody together. It's, really I've lived in big cities and small towns, and sometimes small towns have bigger impacts than the bigger cities. So congratulations. A couple of things, data is going to really be dependent on a lot of what prevention programs go on or what education goes on. So we might end up being dependent on what programs they're developing over here and up there. But some of the questions we had is HIPAA will probably be a barrier for us collecting a lot of information. So that's something that we discussed. The police right now are doing naloxone, but it's such a brand new thing. What kind of data is being collected? Are we linking people up to other services? What kind of demographic information are we getting? So those are things that we would want to know about. Can policymakers start enforcing certain incidences to be required to be reported? So that's something that we had discussed, and Terry Jeffries actually brought a rough draft from another county where they're being required to report certain things to the public health department. So that's data that we can collect. We would like to see some cohort studies. So if we do programs, these people move on 5 years later, 10 years later, do they have jobs? Did they relapse? Those are things that we had asked. And currently we seem to have our people going to Thurston County to get treatment. So maybe we should contact Thurston County to get data on Mason County.
In our group, we actually broke up into two groups, and Sarah took one group. It took us a while to actually drill down to what we wanted to talk about. So the bottom line, the one strategy that we're working on, our next meeting is next week on Wednesday from 6:30 to 8:30 over at the health department. We're actually going to be talking about organizing a way to provide Suboxone or buprenorphine in our community. So we have substance abuse and mental health providers and physicians that we're going to sit down and discuss how we're going to make it happen for people who need medication-assisted treatment. And Sarah was the second group.
Yes, so we decided to divide due to some very strong opinions about medication-assisted treatment and then other treatment needs. And so I was in the small but mighty group of other treatment needs, and we had a couple themes that really emerged, which is the need for youth-focused care, the need for trauma-informed care and trauma care that really gets at the why that's contributing to the substance use, and then expansion of access through both transportation and more options within our community. We had a good conversation about assets, which was really great because I think we were feeling at first that we didn't have many assets in this community, and we're able to come up with quite a list. And then some of the gaps, some of the needs, some of the strategies is really looking at how we expand youth treatment to have accessible inpatient in the region, how we have maybe having a youth drug court, having youth-focused recovery supports that aren't limited to 12 steps, also the need for women's inpatient, women's recovery house, and then trauma and community education were some of the strategies we talked about.
So one other issue that emerged was the issue of access to chronic pain treatment, chronic pain management, thank you. So there was a large chronic pain treatment center that closed, and so there's an access problems for folks who have been going to that center. And so I made the executive decision to table that discussion and to put it as a separate agenda item for the future. So if there's anybody that is interested in talking about that issue and being involved in that, please come to me and I will put you on the list, because that's going to be a separate discussion.